David and Erica, I think this is going to be coming out right before Thanksgiving. So what's happening for you all this Thanksgiving?
Well, I won't be watching the Dallas Cowboys, John, because that's just no fun right now. But I will be getting the leaves out of the closet to extend the table. We'll have family all around. How about you, Erica?
Well, this year will be one of the first in like 15 years that we're not hosting. So I am super pleased about that. We're passing that down to the younger generation at this point. So they're going to take over, and then we're going to go head up north and spend some time in the cold weather after that.
We're north, Erica.
We have a cabin in Pine, Arizona. So it's about 2 hours door to door from where we live in Phoenix to Pine, and super fun to go see different weather. Arizona has different climates. People don't realize, but we sure do.
That's
We'll get into that a little bit. So, John, let's get the show on the road.
Let's do it.
Welcome aboard Lifelines with David and John, your guide to charting the transformative course of crisis intervention and the game-changing 988 Lifeline.
Well, welcome back to Lifelines, the 988 podcast with David and John. We're exploring the history of crisis every week, and no one better to do that than one of the pioneers in Arizona, where a lot of the forward thinking started. Arizona was late to the behavioral health party. We had not much to speak of in the late 80s, but catapulted forward. And Erica, you were part of a lot of that innovation. And we're also going to cascade forward and think about the vision of where 988 can go and should go as crisis care expands and meets the needs of people in pain. But today, John, wow, it's really great to have our colleague and friend with us. Tell us a little bit about our guest.
Our good buddy and colleague, Erica Chestnut-Ramirez, Regional Vice President and Director of La Frontera, Arizona EMPACT Suicide Prevention Center's Crisis and Trauma Healing Services, where, Eric, you've been working there for nearly 20 years, right? I mean, is that right? Nearly 20 years?
Yeah, I've been with EMPACT I just celebrated 17 years, actually. So, I've seen some changes.
And like every aspect of the community crisis care continuum, that's why you're known as the Arizona's community crisis care queen, running La Frontera EMPACT's crisis show of major crisis hotline. You got a major crisis hotline, you got a mobile crisis teams, crisis stabilization, DCS rapid response, trauma healing services, crisis transition navigation services, housing and employment programs. You and La Frontera EMPACT are just killing it. You're establishing unbroken pathways to recovery in Arizona, from the crisis hotline hello to housing and employment opportunities that open doors to people for a life worth living. So it's just so glad to have you with us today, Erica.
Thank you. Thanks for inviting me. I love to be a part of it.
So we're glad you're joining us today. Please like and subscribe on YouTube or wherever you get your podcast. But today, John, one of the things we like to do is learn a little bit about our guest. And we do the super fan segment, Erica, where John and I have a piece of paper, and we're going to write down what we think you're a super fan of. I can tell you I'm not a super fan of election mailers and commercials and texts and all of that. Is it over? I don't think I got any mailer or text yet today. So I'm not a super fan of that. I am a super fan, John. I tend to be a super fan of the NFL, but that's been a struggle for me this year. John, what are you a super fan of?
Well, I'm absolutely a big fan of the NFL. I watched Derrick Henry kill it again last night. So yeah, love the NFL. And now we got to figure out what Erica's a super fan of.
So John, I've known Erica for some time. So John, let's just take a shot at this. And Erica's going to tell us if either one of us is in the ballpark.
All right.
I think Erica is a super fan of. All right, John, I've got my answer. John, you go first. What do you got?
All right. Okay, you ready?
Yeah, I'm ready.
All right. Wait a minute. That's Joey Chestnut.
That's my cousin.
That's your cousin in Brooklyn. No.
Not really.
Let me. That's an inside joke.
Did you try again, John? Monster trucks. Oh my God. What in the world is going on? Is there something I'm not aware of, Erica?
No. John is incorrect.
I don't know if this is April Fool's Day. John is usually much more.
I know you love cars, and I thought I'd just say, let's go big with that.
You gotta go big with it? Okay. Well,
big with that,
you were close, because you do know that I love classic cars. I'm a big classic car collector. So
you're gonna love the monster trucks once you start getting into them, I think.
Okay.
So, Erica, you're a classic car collector. Now, I did see the pictures of you at shows. So, how many do you have? What is your favorite?
Yeah. So right now I have 3. I have a 1956 Bel Air, and she is the queen of my cars.
What color is she?
She is twilight turquoise and ivory. So she's a two-tone. Yeah. So, yep. And she just pulled second place at a show. So I was super excited about that.
So
yeah.
Show. Wow.
Sunday and stuff, or what? How often do you drive her?
I mean, it's a weekend kind of thing, right? I drive her on the weekends when I can. And obviously I don't drive her in the summer because she doesn't have AC, and that's not fun in Arizona. So, but I drive her around. We go to car shows when we can, and it's fun. So I've had her since March. She was my dream car. I have a 1956 Chevy 3100, all black. So it's a pickup truck, and I've had that for about 9 years. And I thought that would quench my desire for the 56 Bel Air, and it did not. So now I have.
Where
do I get them? I find them online. I found the Bel Air just coincidentally when we were driving up to our cabin in Pine, and we were driving through Payson, Arizona, and there happens to be a classic car dealer up there, and it was just sitting outside, and I U-turned immediately and went and looked at it, and I bought it.
Huge garage.
Do you store these at home, Erica, or no?
Yeah, at home. Yeah, I have a 3-car garage, and so we put them inside and drive and put our daily drivers on the driveway outside. So, yeah, and then I have a 1968 Camaro right now that is doing some work on that one. That one needs a new paint job, but yeah. So those are my vehicles right now. But I will be selling that Camaro. So if anybody wants to buy it, let me know. But
what?
I need my Chevelle back. I had a 70 Chevelle, and I'm kicking myself for selling it. So.
Yeah, I'm glad you're mentioning that before Christmas, because I'm sure a lot of people are going to want to buy that car for that.
So, John, you were closer than I thought. Wasn't as outlandish an idea. You were in the ballpark. Erica, I said you're a super fan of Simple Nano Solutions.
Oh, you are amazing, David. So I and this is a clue as to what I'm a super fan of. I do love nails, right? But this is black and yellow. So what am I a super fan of?
New Orleans Saints?
Oh, no, the Pittsburgh Steelers.
Yes, I am a huge Steelers fan.
That is such bad news. In this program now and start with someone else.
So, but you did get it right on your picture, David, where you had the Ohio State nails too, because I am a super fan of the Buckeyes as well. So,
well, and Erica, you're the first Steeler fan I've ever met who's not obnoxious. So.
I'll take that one. I'll take that, John.
I grew up in Nashville when there was no team in Tennessee. And so you were either a region, kids would pick a regional team like Atlanta or St. Louis, or they would go with one of the top national teams at the time. And that was the Steelers, it was the 49ers, and it was the Cowboys. And my best friend when I was 6 was a Cowboys fan, and I've been a Cowboys fan since. And now I'll say it was more fun losing to the Steelers than the last 30 years have been.
When I was a kid, I was a big Love You Blue fan for the Houston Oilers. And of course, they were just traditionally buried by the Steelers and Terry Bradshaw every playoff. So, yeah, I came to hate the Steelers at a young age.
Yeah. You either love us or you hate us, I guess, right?
We hate you, Erica. We hate you, be clear. But John, this hate-filled episode is brought to you by Behavioral Health Link's Crisis Software Platform. Tell us a little bit about our sponsor today before we jump into the meat of this with Erica.
There's nothing to hate about this, David. It's an honor to have Erica with us again today. And as Arizona's queen of community crisis care knows as well as anyone, coordinating care across systems is essential to making sure that no one in crisis gets lost when they need support the most. And that's why the BHL platform's care traffic control technology is essential for supporting reliable infrastructure for your community's crisis services. Utilizing innovative features grounded in evidence-based care, the BHL platform offers a 988-ready crisis contact care solution. I'm sure you know about this, right, Erica? Because it also provides this GPS-enabled mobile crisis dispatch, which I know you all love. And it has outpatient referral and scheduling, real-time bed tracking, and follow-up assistance to assure that your people in crisis are safe, stable, and connected to ongoing care. So it's not just software, it's a lifeline for those in behavioral health crisis. So to learn more about how the BHL platform can support your system's needs, check us out at behavioralhealthlink.com. David?
Thank you so much, John. And we talked about last week that we did have an investment firm approach us recently, and we've had that occur over the years. But this was the first one that shared with us a view of the marketplace. They had done 60 customer reviews, and they concluded that Behavioral Health Link's crisis software platform is a leader in the marketplace, which is a growing space. Erica, we were crisis when crisis wasn't cool. You remember back then?
I do. It's hard to remember sometimes, but yes, I do remember.
So, Erica, we have a few segments in the podcast that we like to do, and the first one we're going to do today is an over-under. The over-under is going to focus on Colorado. So, John, Arizona and Georgia get a lot of love when we talk about crisis services. But the concept of crisis now and the through part, someone to call, someone to come, and a safe place for help, came from work that Colorado did back 10 years ago now. So the over-under trivia question, John, and I would caveat it, Erica, John, that it's a little bit of a trick question.
Okay.
But when the Colorado Department of Health Services back in 2013 put out an RFP for an integrated system, a full continuum of care, they had an expectation on the average response time for mobile crisis. Now, Colorado is a state with both metro, rural, and even territory areas where the population is very sparsely spread out. So what was the average response time expected by Colorado in 2013's RFP, John? And then, Erica, your pick, over or under. John's high or low?
Okay.
Yeah, so we know that a common standard being used by many states now is around 60 minutes. But I'm going to say, given how rural much of Colorado is, they might have factored something different into that. So I'm going to say 2 hours.
All right. So, Erica, I did say there was an asterisk on this. It is that it was a trick question. It is still a trick question, but John says 2 hours. Do you want to say over, under, or something else?
No time at all, perhaps. They didn't even put time in there.
Well, it was interesting because when John started talking and he guessed 2 hours, I went, oh, he stole my answer.
Yeah.
Because that's what I would have said. So I'm going to say they were overly optimistic, and I'm going to say under.
Yeah. So it's a trick question, but it is reflective of the thinking around the different spaces. So a metropolitan Denver, right, is is like a phoenix in the sense of you would expect a rapid response. And Erica, if you can't get there in 30 minutes in a metropolitan area, it's a challenge, right? Because law enforcement can get there in 10 to 15. So, but overall, in the rural areas, I think an hour probably, John, is reflective of what's realistic. But when you're talking about the eastern plains of Colorado, the western slopes, it's just not realistic. So, in fact, what they did was they said, in the metropolitan areas, we want 30 minutes. In the rural areas, we want an hour. And in the western slopes and on the eastern plains, we expect a 2-hour response time. So you guys actually were hitting it dead on, but they broke it out in just exactly that way.
Mark, that's the way it should be done. I think that's a great idea.
So, Erica, I was just looking this morning at the breakdown of Arizona, and states like Georgia that I've spent a lot of time don't really. A lot of the states on the East Coast don't have a frontier area where you've got so few people per square mile, but they have a lot of rural. Here in Arizona, we actually do have frontier area where you can drive and drive and drive and not see anyone. About 10% of our land in Arizona is urban, but 85 to 90% of the population lives there. 50 to 60% of the state is rural, where about 10 to 12% of the population live. But we have 30 to 40% of the state, which is wide, very sparsely populated, and only about 1 to 2% of the population. Some of our Indian country, our reservations, et cetera. So, Erica, talk a little bit about your experience with response times from mobile. What's realistic? What's practical? What are the expectations in Arizona? And is there any breakout here for those kinds of considerations?
Yeah, thanks, David. So it is expected that we have a 1-hour response time within the urban areas for mobile crisis. They expect that we're able to get anywhere within the Phoenix metropolitan area within that time frame. And sometimes during rush hour traffic, if you're going from one end of the county to the other, you really can't. But we try to have our mobile teams dispersed appropriately throughout the county to make sure that we can meet that overall response time. And on average, we are able to do that. We're right around 45 minutes overall for the months to be able to hit that. So, and then there's, other areas where we don't provide mobile crisis, but they might have more of a 2-hour response time as well for those more rural areas for sure. So, yeah.
So, Erica, one of the questions that John and I would like to hear about from you, we ask this a lot, is how did you make your way into this focus on crisis services? What is your origin story, Erica, on your career journey?
Yeah, so I started out, as an outpatient therapist. That's what I did. I loved working with the substance use populations. So those who were struggling with substances, that was my jam. I liked doing like group therapy, intensive outpatient services, and I liked doing intakes. So seeing new people every day. And sitting in my office and having the same people come to talk to me every week, I found quickly was not my jam. That was not something that I liked. I liked more of the fast paced. And I kind of fell into the crisis system. I started supervising a team of clinicians that would go out when a child was taken into the Department of Child Safety custody. We would go out and do assessments for those kids and get them hooked up with ongoing behavioral health services. And that was embedded at the time with the Regional Behavioral Health Authority's crisis system. And I started there, and I loved crisis. I loved the newness every day, never knowing really what you're going into. It was more of that first responder kind of feel where you go out, you help, you assess the situation, you really try to help either diffuse whatever was going on, really help a family in crisis or an individual, and then really try to hook them up with ongoing services so that they no longer needed the crisis help, but they could get ongoing help. So that was really kind of where it was. And it was probably in 2005 that I found crisis services, and I found my way at EMPACT, and I've worked probably almost every part of that job in terms of what we have at EMPACT, and really helped build some of those new programs and new innovation. And it was really just exciting for me. And I just love the opportunities that I've had with EMPACT Suicide Prevention Center.
It got in your blood right away, Erica.
It did.
All of it. I mean, you sampled from the entire buffet of services. As you said, you've kind of been a part of either working in or building every aspect of the crisis care continuum, from someone to talk to, someone to respond, safe place to go, and then all of the transition navigation services, housing, employment, all of that. And I'm wondering, since you really have a nice view, both experientially from the ground as well as from administrative standpoint, Erica, every aspect of that continuum, is there a link in that chain of care that you in particularly think needs more strengthening? And if so, what's standing in the way of it being strengthened, and what do we need to do to strengthen that link in the chain?
Yeah, I think probably for me, where kind of the sweet spot is that link and that hand between crisis services and ongoing services. Because I think, obviously I'm biased, but I feel like our crisis system in Arizona is very strong. And I feel like we all work well together on those three continuum pieces with the call center, the mobile crisis, and the stabilization centers. But it's that ongoing linkage, right? And so I feel like there's still an opportunity there to really help. And that was one of the reasons we designed the Crisis Transition Navigator program, was so that we could help people and give them a tour guide, right? And not just hand them a phone number and say, hey, call this number and get services, It was a way that we could walk them through that process. And that's where our peers reside. They're the ones who can move somebody from a crisis to ongoing services. And I feel like there's still some more opportunities there to really try and move folks into that ongoing care and recovery.
It's a great point, because there's a real difference between what crisis care is. Crisis care is, we're going to make it real easy for you to get care. You can either call us up or chat or text with us, or we're going to come to you. In the ongoing care, you got to go somewhere. And that's a whole different deal, is people actually making their appointments.
Yeah, exactly. And I think, at EMPACT, we've tried to do a lot of community-based outpatient work too, where we have, especially in our children's system, where they can go to the families and see the family in their natural environment and get them hooked up with ongoing services that way, because we just feel like people do so much better in their natural environment, and in terms of, being able to generalize the skills that they learn in treatment to their natural environment. So
amen to that.
Eric, as I'm just sitting here listening to you and John, and we all have the privilege to work with so many amazing folks in this crisis leadership space. But as I think through the people who've influenced my thinking, Chris Carson is one that a lot of concepts I've carried forth from things he said. But I can just sit here and rattle off a lot of Erica-isms from just like two old friends showing up, and out the door in four, and just so appreciate you. And all I did before I realized two things: one, that you're a Steelers fan, and two, didn't even realize till just now that I looked up that the Steelers are 6-2. Erica, you guys are having a good start.
We are, but guess what? We have like the hardest schedule through the rest of the season.
Well, we'll see. That's good. You're off to a good start. Well, the other thing that we do in the program is we have a weekly good news. And John, there's a lot of folks who were rooting for the team that lost this past couple of days ago now that we're recording. But I do want to address the good news of the fact that this work that we're doing is bipartisan work, John. I was in a meeting not even a month ago in New York with Vibrant. And there was a younger individual who was there visiting as a stakeholder, and she was asking, so if Harris doesn't win the election, will 988 go away? And John, I think it is important. It is good news that the Republicans and the Democrats have been huge collaborators around the space of 988 and crisis care in particular. I went back and found actually, there were many news articles, but Vibrant put out a news article when the president signed the National Suicide Hotline Designation Act into law in 2020. And that was President Trump. And it was President Trump after a number of individuals pushed that forward. But among them, Senator Cory Gardner, a Republican from Colorado, was the one who actually introduced S2661, the National Suicide Hotline Designation Act, that was supported by so many people including Representative Chris Stewart, a Republican from Utah, working with Representative Seth Moulton, a Democrat from Massachusetts. They wrote a Washington Post article together at the time urging Congress to support 988. But you had others, Representative John Katko, a Republican from New York, who partnered with Democrats Grace Napolitano and Tony Cardenas, as well as Chris Stewart on the bipartisan 988 and Crisis Services Task Force. And of course, I think something that gets lost over time is that 988 came to us as an idea, largely out of the work of U.S. Senators Daniel Thatcher and Orrin Hatch, Republicans from Utah, and really championed and galvanized by the efforts of State Representative Steve Ellison, a Republican from Utah as well. So, and maybe many others, John, but this has been throughout mobile crisis facilities, 988 have been efforts that Democrats and Republicans have partnered together with. Trump really got that ball rolling from National 988. The Biden administration fueled that going forward and put a wave of energy behind it. But we certainly expect that this is work we'll continue to do with the Trump administration and with both state elected representatives, both Democrat and Republican.
That's absolutely right. And on the heels and wheels of what the Republicans had introduced into Congress, the votes were almost 100% in favor of passing 988 across the political spectrum, across both aisles. I think there was maybe one, I don't remember who it was that voted against it, one lonely congressman. Boo. And and then of course the Biden administration put in about $1.5 billion over 3 years into the Lifeline. So again, both sides are in support of this. Everybody recognizes that people in crisis are everywhere, and there is no discrimination, there are no political lines, there's no parties, there's no socioeconomic status that's protected from mental health crises.
So, Erica, let's shift back to the crisis space, and when we think about a 988, I think most people think about someone who's in pain, picking up that phone and making that 400-pound phone, picking that up and reaching out for help. And of course that happens. But maybe as frequently, it's someone else who's picking up that phone. It's a child, it's a sibling, it's a friend, it's a spouse who is reaching out for someone else who maybe doesn't want help or isn't aware of their need or maybe does want help. But that reaching out and supporting when the caller or the initial contact is a third party is a little bit of a different thing. And mobile crisis services and certainly call centers are right in with that mix. So what are your thoughts on the keys to working with someone when they didn't initiate that contact themselves? How does that play out for you with both the call center and the mobile teams?
Sure. I mean, obviously our services are voluntary, right? So you can't force anybody to talk to you, but it's really about engaging the person and just connecting with them on our base human level, right? And just asking how they're doing and showing that you care about them, so that they feel more cared about and they may be more willing to share, right? It's really all about that engagement and showing that, oh, your wife called because she was concerned about you, that what's going on? How can we help you? And really just connecting with someone on human level that we all get.
Mm-hmm. Yeah. And as you were saying earlier, connecting with them in their natural environment really makes a difference. I think, again, connecting with them in a strange office space may not be their source of comfort. They're not in control of the environment. It's not familiar to them. And they can tell you to go away too, if you're coming to their place. So it is a different deal. So that just the way it's designed, the way you all do the work, the way mobile crisis teams operate is really designed to engage people. But I do wonder, the kids are in that category of, of like, I don't want to talk to you. Are you, I mean, and like, please talk to Johnny. He just won't talk to anyone. He won't come out of his room. And you've had a lot of experience working with kids. And EMPACT, as I recall, in the 80s, they start off as a pediatric adolescent mobile outreach service, right?
Yeah, that's our name. So it's EMPACT, Emergency Mobile Pediatric and Adolescent Crisis Teams. That is our roots. We started in 1987, and we really prescribe to the family systems theory. So everybody plays a role, right, in that family. And when mom calls and asks us to talk to little Johnny, because little Johnny is, quote unquote, the problem or the issue, right? It's usually the family that needs help, and the family is in crisis for whatever reason. Everybody plays their own role in that family dynamic, and we can help the whole family. So maybe little Johnny doesn't want to talk to us, but just as you guys did with me when we started to try and help me feel more comfortable and being in this podcast, you asked basic questions. What are the things that I like to do, right? That makes that connection. And you can do that with kids too that have no interest in talking. I can ask, Mom, well, what does Johnny like to do? Oh, he likes to draw. Oh, okay. So maybe that's his hook, and I can get in, on the drawing with Johnny. So it's really about, again, making that connection and finding something that will turn the corner and allow that person to feel more comfortable. Maybe it's their dog, who knows what it is, but if you can find that hook, you can be able to make that connection.
All around, you can see what's in their room. And again, if they're drawn to their dog, but feel free to use our, what are you a super fan of question if you want.
I might do that.
Right. No, go ahead, David. Go ahead.
So, Erica, let's roll some of this up. We've been talking about the different parts of Arizona and these intersections with the various components of these crisis continuum services. John, let's look a little bit at the three areas of Arizona. First, we've got the urban, and that's largely Phoenix and Tucson. John, I think we've done this in a prior podcast, so I'll ask this to Erica instead. Normally, I would ask John if you ever could see a javelina or a coyote or even a bobcat in the urban areas, but I know you can. Erica, have you ever seen any of those in Phoenix or Tucson?
Yeah. So I live probably about as southeast Phoenix as you can get, just a mile from the Gila River Indian community. And we've had coyotes just trotting down the street, just walking, and like there's nothing. And there's javelinas in our neighborhood. We've seen them as well. So,
Javelinas.
We have, not in my particular neighborhood, but there is right around this area, and it's very mountainous. And so there are bobcats, and you see them. So
now what about, I talked to an ACT worker some years ago, Erica, and she was telling me about, she lived on the outskirts of the city, and she mentioned if she found a rattlesnake, she'd put him in a bucket, she'd take him out into the desert and let him out.
It had a top on it.
Yeah, that's not how most people do rattlesnakes, but have you seen rattlesnakes in your area?
Luckily, I have not. I know plenty of people that have. I actually had a neighbor one time who we just happened to be outside at the same time, and he went like this, and he picked it up over the fence, and it was just a little baby one, and he's all, "You want to see?" And I'm like, "No, I'm good. Thanks. So I'm fine."
No, thank you.
John, we had a guy who was doing a barbecue a couple of years ago, and he decided he would catch this rattlesnake and was gonna serve it up, and got bit on the face. And he woke up. I think it was 10 days later. You have to get. I mean, the chances of survival with that are not good. But they were able to get him. You have to get you have to have the person intubated. Because it's going to swell up and they're not going to be able to breathe. So they got the tube down his throat. They put him in a coma. And then a week later, he wakes up. He's like, "Oh, where'd the time go?"
Oh my gosh.
Oh,
Did you see that story, Erica?
I did not. I have not seen that story, but
So
wow.
that's our urban area, John. But we also have this rural area that we've talked about. And there's a lot of wine country. Have you been to wineries in the rural areas of Arizona, Erica?
I have not.
Yeah.
No.
Here's a question for you, John Draper. Does
okay.
Route 66 run through Arizona?
I'm going to say yes.
What do you think, Erica? Have you had your Bel Air on Route 66?
I have not had it on Route 66, but
It goes through rural northern Arizona, John. Towns like Winslow, you've got the Eagle Song, Williams. Is it Seligman, Erica?
yeah, I don't know if that's how you say it. If you say Seligman, I'm not sure. I don't know. Not sure.
And then we've got a frontier area, John. And I think here's the question that I'll ask you, John. Is it true or false? There have been days that the hottest and coldest temperature in the United States on the same day was in Arizona.
Oh, I would believe that. Yes.
Yeah, it's true. So we've got the elevation change. Erica, I drove my electric car to Flagstaff one time and had some real issues getting there. But on the way back, I got from Flagstaff to my house with 30% of the battery left because it's 6,000 feet down, John, it's a downhill. And that's, of course, why you have the place in Pine, Erica.
It is. So we get to see snow, and it was pretty cold. It was actually cold here this morning, David. It was 39 degrees when I woke up, and I thought,
I had to turn the heat on.
we did too.
Yeah, for sure. So, Erica, in that world that we have we've got wild horses and burros and parts of, even just on the outskirts of Phoenix. But that's the world in which you operate mobile crisis services. You've done mobile directly as well as supervised and been an executive over. So I'm going to run through some mobile scenarios, and you tell me if you or your team have run into them. Number one, the pesky pet. How often does this come up, and do you have a story?
I do have a story. The pesky pet I had, and now you have me laughing, but I remember doing a mobile crisis call and going into this home, and there was this Chihuahua, and I swear it was the ugliest dog I've ever seen in my life, and I love dogs, but this was a really ugly dog, and it had like its tongue hanging out of its mouth, and I was sitting in the chair talking to the person, trying to have a heart to heart with this person, and really trying to talk to them and connect with them. And this dog kept getting up on its hind legs and putting its front paws on my shoulder, and it would like push at me, and it kept like staring at me. It kept like digging at my shirt to get me to pay attention to it, and it was so ugly.
Did you kiss the Chihuahua, Erica?
I did not kiss the Chihuahua. I just kept looking at it like,
you pet their ugly pets.
Yeah. And the lady said nothing about it. I just kept like looking at it and.
Erica, read about turning up that there are substances or weapons in view that you didn't expect.
Yep, that has happened plenty of times too. I've seen plenty of paraphernalia, pipes, what have you, laying on the coffee table. I myself have never seen a gun, but I do know staff who have seen a gun just sitting on the coffee table, and they asked the client politely, "Could you go lock that up somewhere. And they did, it wasn't a thing. So, yeah, we've certainly had our share of weapons and drugs around.
What about a mobile crisis engagement where a crowd gathered? You had bystanders. Is that ever occurred to you?
Well, and the thing that comes straight to mind is when we're asked to do like a critical incident and stress debriefing for something that has happened in the community. And the mobile team comes and there's, caution tape around with law enforcement and there's, crowds in that way. And we're simply trying to, help the victims and those who have been affected by it for sure. Yeah.
Yeah. All right. What about challenges with no cell reception? Is that a common thing?
Oh, yeah, for sure. In the rural areas, there's a lot of times where, if some of our private contracts are in tribal lands, and so we'll go, on tribal land to help folks, and sometimes we don't have any cell reception available. So it makes it challenging for sure.
Erica, talk a little bit about your engagement with tribal lands. I was an executive at Magellan, had just gotten here. And we had, and I don't remember which provider it was, but I guess we had sent mobile. Mobile had gone out onto tribal land and had taken the individual for inpatient care. And I got a letter from the tribal council complaining that we had illegally extradited someone from a sovereign independent nation. So there are some unique challenges and opportunities. How has that worked? To what degree do you interface with our local tribal nations, and what are the challenges and opportunities there?
Yeah, so there definitely are, some tribal lands that are sovereign nations, and you have to be very clear on to what their rules and their laws are.
Right.
We have several private contracts with tribal entities for that reason, so that they have a connection. We have a contract. We know exactly what we're supposed to be doing and who we need to contact. There are many where you have to contact the tribal law enforcement to be able to escort you onto their land. So you can't just, drive right on because they'll see you as an intruder.
Right.
And so there are many areas in Arizona. I think we have contracts with maybe 6 different tribal entities at this point, and they all have different rules and different ways of doing things. And, it's important to be educated for sure.
Yeah, I wanted to ask you, go back to what you were saying about working with kids in homes, because I'm also very much a family systems guy. That was a good deal of my training, and took that into the mobile crisis work that I did too, Erica. But one thing that we did not do that I think you all do is really stay in the homes with people and work for a little while. Is that right?
Yeah, for sure. And, then we're also able to, like what I talked about, when mobile crisis leaves, we can put crisis transition navigator in there to work with them for like a 2-week period while we make those connections to ongoing services. And if we're referring to our own agency, it makes it much easier, right? Because then our mobile teams can connect with our ongoing services and let them know what's going on with the family and how do we work with them. What seems to be effective, and then they can, pick up the ball from there and run with it. So, and provide those in-home services.
Well, you mentioned, that again, working with people in their natural environment is so important. And that's what is also distressing and unfortunate about all the boarding school placements that happen with, the kind of the rehab therapeutic boarding schools where, are often unnecessary, very expensive, and sometimes very problematic for families. And that's not the natural environment. Then they got to come home, and nobody's been trained to how to really work with them in that setting. So is that something that the navigators can provide, is get in-home services, people to come in to work with the families to learn how to basically keep the kid in their natural environment and thrive from there?
Yeah, we have, not necessarily the crisis transition navigators, but we do have, we have family support partners in the outpatient side of the house at Impact, and we have stabilization units. So those, for kids who are in DCS care, maybe they can work with the placement, specifically teach them skills that maybe the child might be learning in an out-of-home placement, to help them generalize whatever skills they've learned in the inpatient setting to then move towards the outpatient setting, and really working with the family, whether that be a foster home placement or maybe it's biofamily as well, but really teaching them those skills and being able to help them utilize those when challenges occur with the child, as
Right.
they will occur, right? Yeah.
Erica, as you have watched 988 roll out in states across the country the last couple of years and seen them make efforts to build out a continuum, what advice do you have, given the fact that Arizona's been focused on this for about 15 years now, given a sort of unique mix of a lawsuit and the health plan and the late to the game? I think we sort of leapfrogged to the front because we were able to learn from a lot of the experiences. So what advice would you give to those who are just getting these things deployed?
Yeah, I think one, obviously you can learn from other systems who've been in place for a long period of time, but I think collaboration is just the key piece, right? Collaborating with your local partners. Obviously, David, you and I have collaborated for many years. We've collaborated with the call center for the state of Arizona as well, just to make sure that the crisis players are collaborating, but then collaborating with your stakeholders.
Yeah.
So getting to know the needs of law enforcement, getting to know the needs of fire EMS, really understanding what folks need, and your lived experience partners in the community as well, right? Making connections with NAMI. What do clients and patients and individuals who are in crisis, what do they need, right? And
Yep.
kind of just, I think building that system of care where you have so much collaboration between partners is just critical. And I can't stress that enough for folks, really building those relationships, just as building relationships in therapy, right, is important. It's also important when you're building a system of care for individuals who are experiencing crisis.
100%. Yeah.
Terrific. So, John, Erica, our last interactive segment, Donald J. Trump was elected president this week. He was last elected in he started elected in 2016. Let's go back to what was life like in 2016. So I've got a series of questions. John, I'm going to look to you to answer, and Erica can say, yeah, he's on or he's not. True or false, John? In 2016, La La Land won the Academy Award for Best Picture.
I'm going to say true.
Erica, what do you think?
We've never seen the movie, though I remember when it came out, but I'm just going to go that John knows what he's talking about, because I have no idea on this one.
Again, this is that seemed like a million years ago after COVID, et cetera, but it was announced as Best Picture at the Academy Awards because the wrong envelope was given to the presenters.
Yeah.
Ow.
Was it called Moonlight, or what was it?
It was Moonlight. Look at you, John. Great. Okay, which app released in 2016 had people exploring their neighborhoods to catch virtual creatures?
Oh,
Pokemon Go. There you go.
Right on.
What role did Leonardo DiCaprio win the Academy Award for Best Actor in 2016?
Good Lord, Revenant.
Erica, he was attacked by a bear.
I saw that one.
Yeah. And he slept inside a bear, too.
He did. Or a horse. Did he sleep inside the horse?
Well, I thought it was a bear.
It was a horse. I think that's right, Erica.
Yeah.
Which musical artist's song became the most streamed song on Spotify in 2016?
Oh. And
I'll tell you that. If you don't know, I'll give you the name of the song.
Okay, well, Logic was 2017 for a period, for sure. But tell me about give me a clue for 2016.
The song was One Dance.
Oh, boy.
I'll give you some options. Was it Beyonce? Was it Justin Bieber? Or was it Drake?
Drake.
It was Drake. It was. Well, let's go to Erica on this one. Which sci-fi series debuted on Netflix in 2016 and became a massive hit?
2016.
Was it Stranger Things, The Mandalorian, or Game of Thrones?
Well, sci-fi. I'm going to go with Stranger Things for sci-fi.
Stranger Things. It sure was.
Yeah.
True or false? The United Kingdom voted to leave the European Union in 2016, a decision known as Brexit.
Was that 2016? Yeah.
That was 2016, John. The Olympics were held in 2016 for the first time in where?
Oh, boy.
London was 2012. So where did it go in 2016?
Was it in
Sydney? No.
I'm sure it was in North Korea. Is that right?
You're spot on, John.
Rio de Janeiro, the first time hosted in South America. The last one. What record-breaking Broadway musical and cultural phenomenon started in 2016? Hamilton. So, Erica, what a great opportunity to catch up and spend some time together. But, John, that brings us to the absolutely true terms of Behavioral Health Link.
It does. Let's see how true they are, Erica. Keep your fingers crossed.
Okay.
So, Erica, the power of mobile crisis teams are to get to individuals where they live, work, play, pray, in their home, in their apartment. And in the absence of those services, people descend downstream. They get involved with law enforcement. They get involved with hospitals. But early in my career, I was doing mobile crisis, carrying a pager. Erica, did you ever carry a pager, or is that predate?
No, I carried one for a long time, actually, David.
So I remember one night, it was 2 a.m. in the morning. So this is an actual picture. There must have been sunlight at 2 a.m., John. But I walked into the hospital emergency department, and it had taken me, I was out the door in 4 because I want to follow Erica's rules, and it was about a 45-minute drive to the Redmond emergency department. And I walked up on the physician talking to the charge nurse, and he explained that he had ordered a charcoal lavage for the young 17-year-old woman who was there for an evaluation, even though she didn't need one medically. But he was going to teach her a lesson for wasting their time in the emergency department. Now, I actually went in and sat down. I was the one who was going to do an evaluation and have a discussion. So he actually had a discussion with a young woman about what was going on in her life or the level of intrapsychic pain that she might be experiencing. He had simply seen that she had taken a few pills, a low-level sort of overdose attempt, and had made conclusions based upon that. What I've since learned in the years between then and now is that a charcoal lavage, even when medically necessary, carries risks. You can rupture the lining, and it's not recommended except in the most severe of circumstances. So it is always a challenge that emergency departments, which are busy and focused, don't have the training, the funding, the education, the support for this kind of work, John. And it sets up the power of these mobile crisis teams to make sure that someone isn't in a hospital unless they need to be there, and if they do need to be there, that we have the supports to work with individuals. So, an outlier in my experience, but this idea of feeling like you're punished, I don't think that's an outlier, John, Erica,
No,
unfortunately.
it's not. I mean, one of the things that was really important to me whenever I could, when I was doing mobile crisis work, David, is whenever people did have to go to the hospital, and it was feasible for me to do so, which often it was, I would go visit them in the hospital as a worker, just to talk with them and let them know that this was really about caring for them. It wasn't about a punitive thing. It's about, how did you get here? Let's talk about how you got here and how we can keep this from happening again.
Yeah.
And often that was helpful, and talking with the families in the unit as well, who would come visit along with me.
Yeah. So, John, I usually try to do more fun, absolutely true tales, but I felt like that one was important to set the stage for some plain truth, John.
I think you need to give us some plain truth, David.
So, John, Erica, it's been 10 years since several of us coined the phrase care traffic control, based upon the idea of supporting the pathway of individuals in crisis through what Richard McKeon would call that chain of care. And I want to go back because I think some of the meaning of that might have been lost over the course of a decade, and give a little bit of a sense of what that concept is and why it's important to us. Tragically, since we came up with that phrase, Virginia State Senator Creed Deeds lost his son Gus to suicide. But it was a little bit more than your usual situation. Gus and the senator actually went for an evaluation. Gus was determined to need psychiatric inpatient care, but they were told that a bed was not available, and he sat in the waiting room while they went on to deal with other people in crisis. And that has been the historic approach to crisis. I think the crisis workers, Erica, people like you, me, and John, and all of you out there who've done this work, who care so much about it, who gets in their blood, they're very engaged with the person in front of them, and supportive and caring and working to link them up. But once that person moves to the side and they're on to the next person, we haven't had the resources, we haven't had the technology or the tools, we haven't had the infrastructure or the coordination to ensure that someone holds that hand and keeps with that person straight through to them getting what they need. It just hasn't happened. It's been often more like someone in one of those war movies where people are coming across the hill and you're fighting, and you just fight what's in front of you, and there's nothing else to do. But that has had consequences, and it did tragic consequences for Gus and for State Senator Creed Deeds. After 8 hours, there was a legal obligation that they couldn't hold him any longer, despite the fact that they had not connected him with services. So he was just left to go. Once they were back at the home, Gus shot himself, but also shot the state senator. And if it had not been for someone who came along on the road, he probably wouldn't have survived, but began to focus his career very much on these kinds of issues. Now, was there a bed available? Was there not a bed available? I've heard over the years both. And I don't think we know because of the way systems have worked. Post-it notes and pieces of paper and the lack of technology and supports, and actually the concept of safety that someone's going to take that hand and hold on to that hand. So in 2001, we had the tragedy of 9/11, and there was a movie made about United Flight 93, which was the one that crashed. John, was it in Pennsylvania where that plane was down? But I remember the first time I watched that film, it struck me, this picture in the film, and you can see they're using the super technology to track planes, but there are these little blocks in the lower right-hand side of that picture that you can see are on that, they're like on a tray. And the blocks have the names of planes, the numbers, the plane, the destination that's on that block. And I've always wondered, what's the purpose of the block? You have the technology. Now, it has changed over the course of time, but in 2001, it was still common to have these, they're called flight progress strips. And the purpose of the strip was to ensure that this individual on the right, he is owning those 7 planes. He's got them. He knows where they are. He knows where they're going. And he's going to hold on to them until that plane is safely landed, or he transfers it to someone else. He doesn't go to the bathroom. He doesn't take a break. He doesn't leave. And I don't know what happened to the planes. Those planes are on their own. They're sitting in the waiting room. Maybe they got where they needed to go. Maybe they didn't. Who knows? No, there's someone who owns them and is accountable and carries them through. That's what those flight progress strips look like. And they made sure that no one got lost in the cracks. Now, when I joined Behavioral Health Link, John, back in 2002, we were already developing our own proprietary software systems to guide this coordination. And these systems would be used by call center staff as well as mobile staff to help guide their work. And it gave us real-time data that we could use for data dashboards and to drive key metrics. But I remember one day I was driving the interface with the technology teams, and the technology team came in and they had crafted this screen that you see here that we called active call management. And I said, what is this? And they said, so this shows the agents that are actually on the phone right now in a correlated sort of a view. So we can see who they're talking to and then how the call is emerging. Have they triaged it as routine, urgent, or emergent? Do they have a referral pathway going on? Have they engaged law enforcement, medical services, mobile crisis team? Are they trying to make a connection? So as the call is live, you can see what's happening, and a supervisor could go and jump in and help out or provide support if needed. And you can see the line, the calls will just, as they end, they drop off. So it's a real-time management tool, and I was like, holy smoke, what a cool tool. And we began using it immediately. And my partner and I, Greg Graham, began immediately to think about, well, what if we use that same methodology to track the planes in the sky? And what we meant by that were the individuals, and this is what we called at the time, the high-intensity service referral tracker. And it was for those individuals who were caught, that young woman in the emergency department, who the ED staff don't want her there, who's attending to her to see where she needs to go, how quickly we can get her out of there, make sure she gets the service that she needs. So we had criteria. You get 25, 30,000 calls a month. But of those calls, there are individuals where a detoxification referral, an inpatient or crisis referral, maybe a mobile crisis team, or even law enforcement or medical emergency services are engaged. Any of those scenarios, we drove that to the real-time management board and began to track the minutes. The state idea at the time was that with someone with a routine need, we had days to get them into an outpatient appointment. But with these, we said, no, it's not average business days till appointment. It's average minutes till disposition. And began to track those with business rules of green, white, yellow, and red, so we could provide ongoing support and people wouldn't get lost. They wouldn't fall through the cracks. When 10 individuals first sued Pierce County in Washington State, saying that they had been held for long periods of time, the initial reaction was that that wasn't true and that those were just outliers, until the Seattle Times did a year-long investigation and found that the average people were waiting in Washington State was 2 to 3 days. And the outliers were in the weeks that someone would be handcuffed to a gurney. So the value in a system of technology that provides us support for the high volumes that this engages. But at the end of the day, it's about those human principles. And Erica, you were talking about just the demonstration of caring and the engagement and taking someone by the hand and walking them through. John, I'm not sure what the best metaphor. Metaphors always carry, some benefits, and then they don't hold true if you press on them. Maybe a rescue swim would have been a better metaphor. But the idea is that we stay with that individual all the way through. And John, that's emerging in our crisis care and the capacity that we have, in the principles, in the technology, and we've got to keep going, Erica, John, until we get all the way there. And someone in pain isn't lost to sitting alone and not getting what they ultimately need to find their way back on the journey to recovery.
That is some plain truth, David. And this notion of not getting lost and us being able to make sure that they're connected on the phone, there's a nearby crisis response team that can find them, and there's an empty bed for them if they need it, or there's an outpatient clinic available to them. All of those pieces of air traffic we need to keep an eye on. But I think the new frontier for us in technology these days is not just seeing where people are, but also making sure that there's a secure and comprehensive exchange of necessary information across that continuum. Because when I see somebody, it's really important for me as a mobile crisis worker then to make sure that I've got the information that the crisis center had when they spoke and got the assessment. So otherwise, that person is going to have to tell their story again, or there might be inconsistencies in the assessment because I didn't have all the information that they had. And so we've really got to be able to exchange information. And this goes back to what you said, Erica, about the importance of collaboration. We have to collaborate and communicate with each other in the field to make sure that we're all hearing the same things and trading that information. And technology can help us with that for sure. David, that's some great plain truth. Erica, thank you so much for joining us today. And remember to join us next week when we welcome DVT and suicide prevention specialist and CEO of NowMattersNow.org, Dr. Ursula Whiteside. Actually, I think it's going to be after Thanksgiving that's going to come out. But for now, stay cool, stay anchored, and look out for the lifelines that we toss your way in the week after Thanksgiving. Take care.